Thank you so much for the honor of presenting the composition in this important debate. I have one disclosure. And I have a disclaimer, which is that I personally would take as many COVID vaccines as you would allow me to have with a rusty needle in my eye. But this talk is about whether vaccine mandates are the best way to address COVID. To my mind, there are two main reasons to have a vaccine mandate: to increase the safety of a specific setting by reducing the risk of infection among people in that setting and thus transmission, and to be socially responsible by improving vaccination rates and thus public health by decreasing morbidity and mortality. As we know, and as is shown in the graph on the right, global vaccine uptake has largely stalled. Vaccine mandates will increase vaccine uptake, but do their benefits outweigh the harms? Let's first discuss the benefits and their limitations. As it relates to the goal of reducing infection and transmission in a setting, there's a big difference between then and now. When the vaccines were being rolled out in late 2020 and early 2021, clinical trials showed excellent efficacy against symptomatic infection. We wondered if the vaccines would also prevent asymptomatic infection and transmission. And soon we had study after study that showed that yes, they did, with 90% effectiveness, in fact, in this CDC study of frontline workers being actively screened for the virus weekly. But now things are quite different. Immunity wanes over time, and the newer variants evade immunity. UK Health Security Agency data from late April showed that for recipients of the Pfizer primary series at the top and the Moderna primary series at the bottom, even after a booster of Pfizer or Moderna, effectiveness against infection is waning quickly, particularly against the Omicron variant, with effectiveness down to close to zero after 3 doses of Pfizer and only around 20% after 2 Pfizer and 1 Moderna. For follow-up periods for the Moderna recipients, they were shorter, but we expect to see more waning there too. So if you look at the consensus vaccine effectiveness estimates from the UK Vaccine Effectiveness Expert Panel, and you focus in here on period 4 to 6 months after the booster, you see that across the 3 vaccine types, you have low rates of effectiveness against infection on the order of 20 to 30%, though you thankfully have preserved protection against hospitalizations. But you might say even a 20% decrease in infection is worth it if you're talking about, say, a hospital setting vaccine mandate, because it means an incremental decrease in risk for the most vulnerable, our hospital patients. But is that true? In this article, the CEOs of several large health systems said they were very worried about implementing a mandate because they were seriously concerned they could lose enough staff to adversely impact patient care. In fact, one health system modeled that they would lose 900 employees on top of 600 open positions that they already had. This is not just theoretical. In one famous case, a hospital fired 55 employees due to their vaccine mandate and then had to ask staff with symptomatic COVID to take care of patients. That's not increasing the safety of a setting, that's increasing risk. And what about prior infection? Is someone who's unvaccinated but previously infected a higher risk to those around them than someone who's vaccinated but not previously infected? Here's a study from the Swedish Nationwide Register looking at over 2 million unvaccinated individuals. In a matched pairs analysis, prior infection conferred a 95% lower risk of infection and 87% lower risk of hospitalization compared to not being previously infected, with no waning over 20 weeks. Sounds pretty similar to what we expect from vaccine effectiveness, maybe even better. And that was confirmed by another CDC study, which showed that being unvaccinated and not previously infected carried the highest risk of infection and hospitalization, but risk was low among those who were vaccinated and among those who were previously infected but unvaccinated. And in fact, once Delta became predominant in October 2021, previous infection was more protective than vaccination. But you might say there are still plenty of unvaccinated people out there who've not been infected, and we don't have a way to know who's been infected. Well, yes, but that number is getting smaller and smaller. Here's US seroprevalence data on the left through February, showing that, especially in younger age groups, we're entering a time when most people have had COVID. On the right, we see that in the UK, as of April, nearly 100% have antibodies from either vaccination or infection, and a growing proportion have been infected. Across the world, rates of seropositivity from infection differ considerably by geography, but as this meta-analysis of 803 studies by the WHO Unity Study Group shows, particularly among studies that were conducted out to late 2021, seroprevalence from infection is getting very high in many parts of the world. So maybe I've convinced you that the benefits of vaccine mandates in making settings safer are dwindling, but there's still the social responsibility to increase vaccination. That's definitely important. And really, is there any harm? Well, I would argue that there might be. When you coerce someone to be vaccinated, when they're scared, or they've been fed misinformation about the vaccine, and especially if you overstate the ability of vaccines to protect the setting in which they work or go to school, and they see and feel that that doesn't appear to be true, that their friends and colleagues are still getting infected and infecting each other, you sow anger, divisiveness, and distrust. You may even worsen hesitancy to receive other vaccines. As this article reported, health leaders and physicians are seeing across the United States. This North Dakota Department of Health graph shows an increase in unvaccinated kindergartners, and it's just one of many such examples of falling childhood vaccination rates during the pandemic. So what's the solution? I say acknowledge people's fears and work to bring them along to voluntarily be vaccinated with data and education, not force. Rome wasn't built in a day. Provide incentives rather than punishment. And one idea for places like the US where there's no universal health care, levy an insurance surcharge like we do for smokers to cover the higher cost of healthcare likely to be incurred by the unvaccinated. Thank you.